Westminster for providing a space and opportunity and support. இந்த இன்டென்ட் என்னன்னா, நம்ம உங்களுக்கே தெரியும், இந்த பார்க்கின்சன்ஸ் நோய் வந்து இப்போ நம்ம இந்தியாவில் நிறைய ப்ரிவாலண்ட்டாக இருந்துட்டு இருக்குது. அதுக்கு மாத்திரை மருந்து இதெல்லாம் இருக்குது, அட்வான்ஸ் தெரப்பீஸ்லாம் இருக்குது. ஒரு புது வகையான தெரப்பியை லான்ச் பண்ணியிருக்கிறோம். ஆக்சுவலி ஒரு ஃபியூ மந்த்ஸ் ஆச்சு. ஸோ அந்த தெரப்பியோட இம்பார்ட்டன்ஸ் பற்றியும் புதுசாக லேட்டஸ்ட்டாக என்னென்ன வந்து நமக்கு அதில் மூலமாக நமக்கு வந்து மக்களுக்கு பயன்படுற மாதிரி, அதாவது பார்க்கின்சன்ஸ் பேஷண்ட்டுக்கு பயன்படுற மாதிரி என்னென்ன தெரப்பிஸ் இப்போ அவைலபிள் இருக்குதுங்கிறத பற்றிய ஒரு சின்ன கலந்துரையாடல், அதுக்காக தான் நம்ம இது பண்ணது. So as I have already told you, I am Dr. Babu and I represent the medical director for the Celera Neurosciences. We are trying to bring in the pumps and pens to India. Sir வந்து Dr. Arun, he is the president of Westminster Hospital. Sir Professor Ravi Kumar, Lieutenant General, he is Pro VC from SRM Medical College. And Sir senior most physician Dr. Ganesan, that is Dr. Vinod Mehta, who has come for a symposium occasionally. He flies down to give these talks, come here and give these talks, and he had been practicing this advanced therapy for the 10 years or so. So இது இருந்ததுனால அவரோட எக்ஸ்பீரியன்ஸை ஷேர் பண்ணுறதுக்கு இது ஒரு பிளாட்ஃபார்மாக இருக்கணுமே ரெக்வஸ்ட் பண்ணோம். தேங்க்யூ டாக்டர் வினோத் ஃபார் ஜாயினிங் அஸ். திஸ் இஸ் டாக்டர் சங்கர், ஹீ இஸ் அ ப்ராக்டிசிங் நியூராலஜிஸ்ட்.
இது லைக்காவோட ஹாஸ்பிட்டல். ஸோ லைக்கா பிரம்மாண்டத்துக்கு பேர் போனது ஹெல்த் கேரில் வரும்போது அது வந்து அஃபோர்டபுளாக பெஸ்ட் குவாலிட்டி டெக்னாலஜி கொண்டு வரணுன்ற ஒரு எண்ணத்தில். ஸோ இப்போ இந்த பார்க்கின்சன்ஸ் கிளினிக் டாக்டர் பாபு நடத்திட்டு இருக்கிறதுல பார்த்தீங்கன்னா அந்த மேனேஜ்மெண்ட் ஆஃப் பார்க்கின்சன்ஸ் அந்த மூமெண்ட் டிஸார்டருக்கு மோஸ்ட் அட்வான்ஸ் அண்ட் அஃபோர்டபுள் டெக்னாலஜி இங்கே கொண்டு வந்திருக்காங்க. ஸோ வி வாண்ட் யூ டு டேக் திஸ் மெசேஜ். இந்த இது வந்து இந்தியாவில் முதல் முறையாக இங்கே தான் ஆரம்பிச்சிருக்கு. ப்ளஸ் இப்போ பெங்களூர், ஹைதராபாத், மற்ற ஸ்டேட்ஸில் இருக்குது. பட் தமிழகத்தில் இங்கே மாத்திரம் தான் அவைலபிளாக இருக்குது. ஸோ இந்த மெசேஜை பப்ளிக்கு ரீச் பண்ணும்போது இட் வில் ஆல்சோ கிவ் பெனிஃபிட் டு த பப்ளிக். ஸோ ஐ தேங்க் ஆல் த ப்ரெஸ் ஃபார் கம்மிங் இயர் அண்ட் ஐ வில் பி வெரி தேங்க்ஃபுல் இஃப் யூ கேன் டேக் திஸ் மெசேஜ் டு த பப்ளிக் ஆஸ் வெல்.
So we age, that means every year you celebrate your birthday, you lose dopamine in the brain. But for some patients, like diabetes, you lose insulin. So patients with Parkinson's, they lose dopamine. So first year of losing dopamine, they'll get stiffness and shaking. Then you take oral tablets, fine. Like diabetes oral tablets, then all good. 1 year is good, 2 years are good, 3 years are good. The more you're losing the dopamine, and the more you're giving the tablets, say for example, every car, doesn't matter, a Rolls-Royce car or any car, after driven 100 miles, the full tank of petrol will become reduced. Agreed? Yeah? So how to fill it up is an art. Say for example, if you want to go to Chennai airport, would you be happy going in a Chennai traffic? Or if you have option of a flyover, what would you do? Flyover. So that means there's a quickest way. If you take for all Indian patients, like all Asians, our lifestyle, like we love our curries. You know, last night I went to nice Chettinad curry. Yeah? Still, we can't open up the bowls. When you take the tablets, then they go in the stomach. Say like doctors like Ganeshan, we all have diabetes, high blood pressure, arthritis, Ayurvedic tablets. They're all very powerful because diabetic tablet can work for 12 hours. Blood pressure tablet can work for 20 hours. That's why we only give once a day or twice a day. Whereas a dopamine molecule only works for 3 hours. The minute you take it, it should go to the brain, or else it becomes stiff. If they get traffic jam in the stomach, all 5 goes to the brain once, then they dance. I'll show you in my talk. So to get that balance right, then we got this flyover option. Since last 10 years in India, we don't have these flyover options. They only have tablets and tablets and tablets. Or they'll ask you to go for a brain surgery. Do you want to keep a hole in the brain or a small needle in the skin? So this therapy, we're using it since last 20 years, like 20 years in Europe, UK, Australia, America, even in UAE. Yeah, but here, lack of awareness, no knowledge, lack of experience of using these therapies. That's why no one bothered to bring this over. Now I'm thankful to Westminster Hospital and so they got this German same thing which we're using back home. So the advantage of that is, say for example, if you have a Parkinson's stabilized nicely, we call it as predictable, unpredictable. say that, Dr. Vinod, my Parkinson's is fantastic, but suddenly I don't know when I'm stressed or, I become very stiff. When I take a tablet, it's not working. Going to the airport, you got stuck up in the, security, I can't move. Then the pen will work. Pen will start working within 6 to 10 minutes. Again, I'm repeating here, 6 to 10 minutes and last for 90 minutes. So that you can reach the airport and you can ready for the next tablet. Whereas you have to take the pen every half an hour because you want to be running, then we go on to the pump. So pump 9 a.m. to 9 p.m. or sometimes you can go up to 24 hours. When pump is on, patient is on. So that's it. So you got my point. When to use the pen, when to use the pump. Pen, it's like a rescue, add-on. So we don't change some patients doesn't want to change the medicines. In between, they use the pen. Some patients are on 20 types of tablets. Then, they're interacting with diabetes tablets, hypertension tablets. Then, hello, we don't need it. Just give the dopamine a flyover, then the rest they can take over. Is it something you agree?
Yes, sir, of course.
Yeah. So that the half-life is very important.
This is the latest therapy.
Last tablet. I don't know which pharma is doing it. So from 2013 to date, this only option is the surgery. But keeping a hole in the brain, you want your daddy to have a hole in the brain, you need to have a skilled surgeon who does this every day. If something goes wrong, then you become completely paralyzed. So our guidelines, the government of UK and British, American, European guidelines suggest first this pump treatment before even think of surgery. So this we use as a medical treatment rather than a surgical treatment. In India, everyone is aware of insulin pumps. Same thing, same insulin is dopamine.
Yeah.
Same pump, we use the pump. The reason why is a third generation pumps. You see, the iPhone 13. What is the difference between iPhone 5 and iPhone 13?
Yes,
Technology.
Technology.
Yeah, iPhone 5, patient has to break ampules. And if you're shaking, how can they break ampule? And they're all spilling. And the carer has to come and fill it. Whereas iPhone 13, the latest one, it's already pre-filled. So change it every week. So that's the technology.
Is it like diabetes?
As you, like elderly patients. But in South India and in Middle East, I'm talking about South India, say Chennai, Kerala, what I'm seeing now is very young age. I have seen patients, we have treated at Westminster, I'm telling you, 29, 30, having Parkinson's. And in Arabs, they have 30, 31, having Parkinson's. We call it as YOPD, young onset Parkinson's disease. That's what our hospital, King's College, is very famous for, genetic testing. So in Dubai, in Middle East, they inbred themselves, so they have the genetic predominant. So I'm very keen here, in South Indians also we're getting a very young onset Parkinson's. Same thing in Parsis in Mumbai. So they have also, so there is a genetic component for young onset. So if a patient gets at 65, that comes under normal age-related Parkinson's. If it comes at 45 or 40, it comes under young onset Parkinson's. So if you get a Parkinson's at the age of 40, then I need to look at him for next 30, 40 years. If you get a Parkinson's at the age of 65, then we look at it 15 years. So that's the treatment, and we have a privilege here. We have treated both age of 40 and age of 80. The first chap of Tamil Nadu, of 83-year-old in the history, being treated at, I'm sure Dr. Bob will highlight that.